Hello, and welcome to this edition of Cancer TV. I'm your host, Kelly Hartman. During this broadcast, we'll highlight some of the important cancer information presented at the American Society of Clinical Oncologists annual meeting in Chicago. Erbitux, a targeted therapy drug marketed by ImClone Systems Incorporated, is used in the treatment of advanced colorectal cancer. A study reported by investigators from Europe suggested that not all colorectal cancer is sensitive to the drug. The so-called CRYSTAL study showed that patients with mutations of a gene called KRAS do not respond to the addition of Erbitux to their chemotherapy drugs, while patients who do not have the mutation do benefit from including Erbitux. The study suggests that further evaluating this gene mutation may help physicians identify patients who may benefit from Erbitux treatment from those who don't. Arm lymphedema, or swelling of the arm, is a well-known complication of breast cancer surgery. It usually occurs after lymph nodes removal from the armpit. One of the treatments for lymphedema includes the restriction of the patient's physical activity of that arm. Researchers divided 204 women who had lymph node surgery into two groups. One participated in high-level activities with no physical restrictions using the affected arm. The other group had low-level activity with restrictions. The swelling of the arm was measured at 3 months, 6 months, and 2 years after the surgery. The investigators found that there was no significant difference between the high-level activity group and low-level activity group in their arms' swelling. Zoledronic acid, marketed commercially as Zometa, helps cancer patients from disabling bone complications such as bone fractures. Zometa, made by Novartis AG, is currently used for cancers that have already spread to the bone. However, there are suggestions that the drug may also help against the cancer itself. Researchers from Austria reported that Zometa reduces the risk of cancer recurrence in premenstrual women with early-stage breast cancer when given together with hormone treatment. Zometa cut by 1/3 the chances that cancer would recur in the bones or anywhere else. Experts stress that the results are so far only in women who were made menopausal by hormone-blocking treatments, not women who develop breast cancer after natural menopause. Breast cancer is the most common cancer in women. About 184,450 cases and 40,930 deaths from the disease are expected in the United States this year. That's all for this week's edition of Cancer TV News. I'm your host, Kelly Hartman. Join us again next time.